There is a difference in the way local health departments track and report recovered COVID-19 cases. It affects what you might see on the county's dashboard.
Here's a look at the latest numbers of active and recovered cases in our KXAN viewing area, and you can see here Hays County really standing out now at more than 1,900 cases that are active. Travis County, on the other hand, reporting just 666 active cases, despite having a much more populated area. KXAN's Tahera Rahman reports the difference is partly because some counties follow up with patients while others use a formula to estimate.
At first, it was just headaches, tiredness, stuff you get from being stressed out.
In March, Jalen Kozad ended up in the hospital for COVID-19.
Literally, I felt out of breath just texting, sitting there.
Kozad didn't feel much better until the end of June. That's when Hays County followed up, and Kozad told them the case could be considered recovered. But not all counties follow up with patients. In June, Austin Public Health started automatically marking patients recovered after 14 days, or about 32 days if they're hospitalized. The difference is reflected on the county's dashboards. APH says following up with patients directly takes too much time and causes a lag in data. Hays County says the payoff is confidence that the residents marked as recovered are, in fact, symptom-free.
We're still gathering a lot of data since this is a new infection.
Dr. Elizabeth Douglas with Dell Medical School says new information indicates more people are showing COVID-19 symptoms past the 2-week timeline.
In the outpatient system, where you've got milder illnesses, there is still a significant percentage of patients that are reporting symptoms beyond 14 days in the range of 30 to 40%.
Kozad says even when a COVID case is considered cleared, people should know there could still be a lasting impact.
There are a lot of people out here now with heart issues, breathing issues, all kinds of different odd symptoms popping up. And it's not just about death and recovery rates. You know, there's a lot more to it.
Tahera Rahman, KXAN News.
The recovery calculation used by Austin Public Health is from the Texas Department of State Health Services. It's used in Caldwell County, a similar system also used in Williamson County.
The Department of State Health Services is changing the way it reports the positivity rate in Texas. From now on, the state will report 3 separate rates. The first is the way it's been reporting it. The number of new cases in the past 7 days divided by the number of new tests. They'll also report a new rate based on specimen collection date, or the date a person was tested for COVID-19. This rate will fluctuate as new data comes in, and they'll also report a rate based on the date that the lab reported the test results to the state. That one will only be reported for a period of time. The changes will soon appear on the state's dashboard. DSHS says that the changes will more accurately reflect what's happening. That's because it removes the lag times between when someone gets tested and when cases are reported.